Okay, good morning all. That's 10 o'clock, so I think we can start.
Okay, thanks, Chair. Can I just remind everybody that the meeting is being recorded and will be placed on websites for public viewing. And I'll now take a roll call for the minute. Councillor Lynn.
Present.
Bob Benson.
Present.
Councillor Toland. Councillor McHugh.
Present.
David Cheap.
Yep, present.
Colleen Carrollton.
Present.
Glenn Lloyd.
Present.
Dave Berry.
Present.
Christine Jones.
Present.
I've had apologies from David Wilson. Susie Brown.
Present.
Sanjay Pillai.
Present.
Raymond Marshall.
Present, thanks.
Jim McFarlane.
Present, Arlene.
I've had apologies from Christina Cooper. Martin Sloan.
Present.
Emma Fletcher. I've had apologies from Dr. Shaw, so that concludes the roll call. That takes us on item 1, apologies, which have been noted. Item 2, declaration of interest. Are there any declarations? Not seen any declarations, so that takes us on to item 3A, which is the minutes of previous meetings held on the 19th of February and the 26th of March, which are submitted for approval.
Okay, so we have two sets of minutes here. The first one being of the meeting of 19th February. I'll just go through this page by page. And if anyone has any comments about inaccuracies, etc., if you could just speak up. Page 1, page 2. Actually, I'll just bring this up so I can see people's hands are up. Page 3, page 4. Page 5. Okay, thank you. I'll take that as agreed. And then we have the meeting, budget meeting, which was held on 26th of March. Page 7, actually, so I'll just read it. Is that page 7? Well, it is on my copy anyway. Page 8. Page 9. Yep, that's agreed then. Thank you.
Okay, so that takes us on to item 3B, which is the action tracker, which is submitted for noting and updating.
Thank you. Any comments, questions on this? Yes, Dorothy.
Sorry, my camera's not working
That's all right.
temporarily, I hope. Yeah, there's items 3, 4 and 5 on the action tracker, which are shown as complete. And they're about updates and bringing a couple of reports to a future IJB meeting. But I think they should remain. I don't think you can say these are complete until we've actually had the action completed, i.e. had the update and the report. So I don't think they should be marked completed until we get what we asked for.
Any comments on that from Dave?
Yeah, thanks for that, Councillor McHugh. Yeah, I think we can quite happily kind of change that to Amber in terms of in progress. Just now, I think the reasoning was because we've now added them to our formal kind of report tracker, which means we know which ones will come through. But I absolutely take the point until they're actually presented in front of you. We probably shouldn't have that as green just now, so we'll change that.
Okay, thank you.
Have you got that sorted? Okay, next item, please.
That takes us on to item 4, which is the Learning Disability Inpatient Transition Programme update. And this is for a decision.
Okay, who would like to speak to this? Jenny? Dave?
Yeah, sorry, I'll just do a bit of an introduction of Jenny wants to kind of take this on. I did hope that Sandra McLeod from NHS said would be able to join us today to kind of talk to.
Is she planning to join us?
I thought she was. I've emailed her to kind of to ask if she's not able to join or whatever. So
I was just thinking we could take it further down the agenda if she's definitely going to come. But if you don't know, I think we're better just to take it just now, if it's not definite.
Do you want to give me a few minutes to try and see if we can, if she's available, and then we can come back?
I think it's quite an important item. It'd be good to have the most up to date.
Chair, I agree with you, Chair. I think we should just defer until Sandra, we know whether Sandra's available or not. It's such a key document.
Yeah, I agree. Yeah.
Okay, I'll continue to try and get hold of Sandra then, if we move on to the next item. Thanks.
Okay, we'll just take that as soon as if and when she's available, and then move on to the next item just now, which is item 5. On page 61. Arlene.
Yep, sorry, that's item 5, Equality Mainstreaming and Equality Outcomes Progress Report 2023 to 25. And this is also for a decision.
I think, Claire, were you going to pick this one up?
I am, and this is mainly the work of, well, many people, but Joyce Barclay, who's off at the moment and not here right now. So just to take you through it, the progress that's been done. So the IJB, under the public sector equality duty, has duties that they need to do to promote equalities. And our equality mainstream and progress report notes the progress that's been made, in particular listening to local people, equality training, integrated impact assessments, accessibility of publications and information, and workplace discrimination. So those are the 5 main areas that have been focused on. And in particular, I suppose we'd want to point out in the report on page 67 going onwards, so our published information in a manner that's accessible to people. We've also had feedback from the Equality and Human Rights Commission that our integrated impact assessments are kind of displayed. They're happier with the progress we've made with that they can find it easily on our website. And just taking you through the work, all that work that's been going on across NHS Tayside and the council and our other organisations that we work with. And if Joyce was here, she'd do it so much better and highlight the work that's been done, because it's really good.
Certainly has been a lot of work going on, which is reflected in the report. Anyone have any questions on this or comments? Dorothy. Your hands are, maybe you're trying to speak when you're on mute, Dorothy.
Oh, I beg your pardon. You're right, Ken.
But I can't see your face, so I don't know if your lips are moving.
They usually are.
Yeah, I noticed.
Page 81 of the pack, it's page 16 of the report, is the equality outcomes. And it lists key achievements and next steps, but it doesn't actually make any assessment of whether or not the outcome has been achieved, or to what extent. I suspect that next steps is the detail where we haven't yet met the standard, and we're 2 years through, I think, a 4-year period. We're halfway there, and I'm wondering how we can make an assessment of, are we on track with this? There's no indication in the report of, what, if anything, has been achieved so far.
Dave, would you like to come in? I usually have a list of who's going to speak. I haven't got it today, so I'm having to put you all on the spot. Sorry.
So, like, come back in on that one. So yeah, it's a good question, Doris. I think it's fair to say this. So I think you're right, because we've got the kind of next steps, so we can't say that we've kind of completely kind of finished off and met all the outcomes that we've kind of set ourselves. Excuse me, within that. So I think this is that kind of update just now. we probably won't kind of truly know until we've got to that kind of that final stage on that and have those next steps through. So it probably doesn't kind of completely answer your question, but I think it is just an update report, a kind of progress report, and a reflection on all the activities that we've done to date on that. But again, we'll take away that point and reflect back in terms of how we might want to make that a bit clearer for IJB members.
Thanks, Dave. Yeah, I think some indication of, if we get to the end of year 4, that's a bit late for not having achieved the outcomes. It'd be nice to have a heads up partway through as to how we're progressing with this. Thanks.
Next up is Bob.
Thanks very much indeed. I suppose my question is probably similar to Dorothy's, actually. I think, again, I'm more interested in what's actually happening. It's a so what question. So what has changed is really what we're trying to look at here. And particularly looking at the overall impact of integration, full stop, would be, for me, one of the key questions. Where are we successful in terms of that integrated approach that we're working with other partners? So I would take it to that broader level. And just thinking ahead, and we've seen many of the advantages just on equal opportunities and the public sector duties and the Fair of Scotland duty. And we know that we can evidence this anyway, so I don't really have a problem with that, because I know that we can do that and we've been working towards that. But we're moving now into a different area of much more about socioeconomic disadvantage and how that impacts on people's equity, as well as the impacts of diversity and inclusion. And this is something that the chief officers across all of the IJVs, across all of the health and social care partnerships, are now signing up to. And I'm curious to know that we can differentiate between addressing the equal opportunities provisions that are monitored by the Equality and Human Rights Commission, and looking ahead to what we're now looking at a higher level, a broader level, about socioeconomic disadvantage and how that impacts on equality issues and equity issues, full stop. Because I know that will be written into Dave's own work plan moving ahead, and I'm just interested in just teasing out those differences as we move forward. I'm just raising it as an issue that will emerge out of this discussion, Ken. It's going beyond the equal opportunity stuff now, and poverty is a big issue in Dundee.
Sure, absolutely. I know that this is a report on 2023 to 25. Is that every 2 years then? Because that means it would be 2 years before the comments that have been made today are reflected in the next report. Is it every 2 years? Or will we did we miss a year because we were busy with other things, maybe?
I think it's a 2-year. The progress report is
it's a 2-year exercise.
It's a 2-year exercise, I think.
Okay, Jim McFarlane.
Yes, thanks, Ken. I suppose it's just raising the issue around things that are on pages 91 and 92 around the MCR pathways, which is the great work that that does with mentoring young people and helping them attain, both maintain their attendance in school and all the rest of it. That I know there's a process going on at the moment that funding is ending, and it means that the people who are the Dundee City Council certainly employ within our schools at the moment looks like it's coming to an end at the end of this term. So I suppose it's just then for this body is how much input do we have at the discussions on either what will either replace that or if there's some sort of other way of reorganisation going forward on doing some of the work that's currently done by staff that have been employed in schools, and because it's been fixed term funded, it looks like there's a potential there that these staff will have their contracts ended at the end of June. Which is certainly a concern for us on that basis, but also then the possible knock-on effect to what that will mean for the young people, and then obviously the wider community and stuff like that as well. Now, I get that that's a children and families issue, but obviously it's in this report, and I think in some way the IJB should have certainly some sort of either input or involvement in what happens with that service.
Yeah, because certainly the report waxes lyrical about the work that's done by MCR Pathways, national award-winning mentoring programme dedicated to addressing the inequality in education outcomes, etc. Any views on how we could interface with children and family? Well, obviously we have Glyn here. That's sorry, Glyn. You should have been my obvious go-to there.
It's a good question. Obviously, there is reference to MCR on page 26. The programme itself isn't funded by the IJB and doesn't come under the IJB's governance arrangements. It's mentioned in the report because health and social care staff obviously contribute as mentors. As Jim says, it is being reviewed by education colleagues at the moment. I'd be more than happy to have an off-table conversation with Jim and others about progress in relation to that. We probably want to include those education colleagues, not least Paul Fleming as head of education.
Sure, does that sound good to you, Raymond?
Thanks.
Sorry, not Raymond. Raymond's next up. I mean, Jim. That sound good to you, Jim? An off-table discussion about this?
Sorry, look, I understand there's a process taking place on that, and I'm not saying we're not involved in that. And I was at meetings yesterday morning, kind of one-to-one with the staff involved, and we've got them planned for the rest of this week and stuff like that. It's more than, we're not quite sure exactly what that will deliver, but I suppose then because it's in this report, it does come under the IJB remit in the sense of the difference that service makes and over the equalities issue. So happy to kind of have a further discussion. And as I say, I'm not trying to allude to say we're being excluded from that. I understand that that's an ongoing thing, but I would then say it is a concern, in that sense.
Thanks, Jim. Raymond.
Thanks, Ken. And Glenn, I would ask that it could be included in those conversations because they do affect some health employed staff as well, and unfortunately they're not getting meetings, which is quite a concern, the same as what's been given to the other staff. Thanks.
Dorothy.
Just to say that clearly the IJB has an interest in this, and it will affect our outcomes going forward. So could we be kept up to date, or could we have a report on the result of these discussions, the outcome of what could possibly be put in place?
You should be updated. I'm not sure how much of an influence we can have, given that this is children and families. Dave, any thoughts on that?
So I think probably kind of more out of courtesy we can do some reporting back around that. As you say, so those mentioned in the report, it's around about the input that health and social care partnership staff have had into that kind of process as well. So I think we can put something back. If we note that for the action tracker, we can provide a response on that once that conversation has been had.
So given the level of interest that's been shown in that particular project, I think that would be useful. But of course, there's lots of areas where there's work that goes on in other departments of the council and NHS Tayside, which doesn't fall under our remit, but which is relevant. It's useful to be aware of that, Bob.
I appreciate the issues around waiting for the next iteration of this report. I would have thought there should be an ongoing communication exercise anyway, through the council and partners on this work, because there's a lot of good work happening, and I think there should be some kind of regular update, some kind of quarterly or something that would be publicised beyond the IJB, because I think this is of great public interest. I think, as Dorothy has highlighted, and just looking at the work, for example, as we've done with disabled and older people, for example, I do think there's a lot of good work there that is in the public interest, and I think that we should support any way in which we can get this communicated out there beyond an IJV meeting. I think that would be more useful in the short term.
Thanks for that. So we're asked to approve this mainstreaming and equality outcomes progress report. Is that agreed? Yeah, thank you.
So I think we can now go back to item 4. Dave, is that correct? Yep.
Yes,
Item
thanks,
4.
Ali. I was just about to say that. Thanks.
Yep. Learning Disability Inpatient Transition
Okay.
Programme update, and it's for
Excellent.
decision.
So who is it that's joined us then? Sorry.
So Sandra McLeod's kind of managed to join us. So
that excellent. I just can't see her on my screen, right? So
so no, thanks for joining, Sandra. So we've kind of skipped the agenda to get it, and we'll come back to this one. So I'll just say kind of a couple of words of introduction, and then I'll maybe pass on to Sandra if that's okay. Around this. So this is so as the report says, this is an update in terms of the kind of progress around the kind of learning disability inpatient transition programme that we've kind of reported back on previous occasions to the IJB in terms of the decision made around the transition, and then kind of a further progress report. So we're kind of looking at progress reports every quarter on this. So this is the kind of latest report. So we've got a kind of bit more of a detailed report on the appendix that Sandra has produced for all of the IJBs and for NHS side around progress around that. So I'll pass on to Sandra if Sandra wants to kind of pick out some of the sort of kind of main points and highlights, and then we can kind of open up for questions. So thanks, Sandra.
Yeah, absolutely. And apologies, Chair. Bit of a diary mix up there. You caught me just as in the car, so
no problem.
apologies
just to move a bit further down the agenda.
Yeah,
so thanks a lot for coming.
That's okay, and thank you for accommodating. So the paper that you've got in front of you, as Dave said, this is the second quarterly update report that's came to the IJBs. This is the first of the IJB. It will follow on to Perth and to Angus as well. It's been through clinical governance within NHS, Tayside's board governance structures, and will follow on. The paper outlines and still remains the context of the original recommendations that were approved by the Chief Executive's team in June last year, of which set up the task and finish group. And this is an update on progress against each of those recommendations. You will see that there has been work that's been undertaken, but we have, in particular, about the location and the move to Murray Royal, there has been some significant work that's been done with the clinical teams and the estates team on what that environment needs to look like, particularly for the enhanced care units. So we're waiting for dates coming back from both the architects and the PFI about what the actual date for that will be. And there will be further papers getting produced on definitive timelines for how we will be moving that forward. There has been additional papers that have moved through our governance system with relation to the staffing risk and the moves on the workforce issues. So that's all progressing. And really the paper just gives you an update on the progress that is to date. I'm happy to take any questions on this.
Yeah, thanks very much for that, Sandra. I guess my only observation on this paper would be that I would have hoped to have seen some kind of indication of timelines, or when is it actually going to happen? Because it seems like we've been talking about this for a very long time, but it's not in there. So, and I guess because it's not in there, you wouldn't be able to particularly comment on timelines or dates unless.
No, so I can give you an understanding why there isn't. So if you recall, when we set off, the ambition was that by August 2025 this year that we would have a single site for learning disabilities. In conjunction with our clinical teams, one of the key things that we were keen to do, although this was a move to a better environment, there is some bespoke environment at Strathmartin that has been adapted over the course of the years to meet people's needs, and doing a lift and shift, if you like, was not going to meet those needs. There were some changes that would be required to be made, particularly for the enhanced care unit. which is on the Strathmartin site. So there's been a lot of work that has went on with the clinical teams, engaging with the architect, with the estates, going down to view the site, looking at the current the current patients that are there and what that needs to look like. There had been hope that we might have been able to have quite a number of the delayed discharges moved on, but being realistic, that's not actually proved to be the case. These are not delays that can be moved like as in an acute bed. You know, we're in today and out tomorrow. They do take several months, in some cases years, to get suitable transition plans for moving out. So we have planned for a like-for-like basis at the moment. And what that's meant is to ensure that we do get the best suitable environment, that we have taken our time with the clinical teams in the States to get that through. The final meeting of that and agreement of the plans, I think they're in here, has been through, we're just waiting for the dates now. It's a PFI initiative, Murray Royal's PFI, so we need to work with our contractors, figure out the dates, and that'll be there. However, we've also had 3 events earlier this year, which were around working with the wider staff teams about looking at what's the opportunities meantime, because this is really unsettling for staff, and it's unsettling for patients and unsettling for families, not having the time. And just as you've expressed, Chair, that feeling of when we seem to be taking our time to do this. So we've had further meetings with staff teams and looked at opportunities for what could we do in the meantime, and is there other areas, what's the codependencies of the moves, and how can we shape that? So that has been really meaningful and helpful discussions with the staff groups, and there is a paper that's been prepared at the moment with a view to that coming through our governance systems to get approval for moving that there. So it may well be that, I think initial thoughts were this would be a one-phase move. It's likely that we will be talking about, probably there's 3 stages that we will be moving at, and that's the paper that will be there. So I would be confident that our next report that we're coming forward to the IJBs will have firm deadlines, with firm timelines on that, and with a real understanding about how we're making progress. I think a lot of the work that's been is the background work and getting things in place to make sure that we're all moving together cohesively. But I absolutely acknowledge the frustrations by everybody, myself included, I'm sure, about this not getting the timelines. But it is important that we do this with in that sense of collaboration and get things right. But as I say, I would give you assurances by the next quarter report you will have a lot more firmer detail.
Okay, thanks very much for that, Sandra. Dorothy.
I had exactly the same questions you, Ken, reading through this report, and the absence of any timescales for implementation, but we've had an explanation of that. The other thing that jumped out at me was the delayed discharges, the proportion of delayed discharges of the 24 patients, and that's really concerning. I would like to know what how when are we going to be able to say we have proper community settings for these people to be let out back into the community. The time that this is taking is really a concern for me. I mean, I think this was originally spoken about in 2018, and I know COVID intervened, but we're now in 2025. Could you address the issue of the delayed discharges, because it's 16 out of 24 of the inpatients. Could you say something about that?
Yeah, Chair, are you happy for me to respond?
Yeah, absolutely.
And I think that possibly either Jenny or Dave may want to come in and respond to this as well. So there has been a real collaboration between the Health and Social Care Partnerships and the inpatient team about how we can really look at helping move the delayed discharges forward. As I'm sure you're aware, these are really complex delays, and it's not a case of that. In many cases, they're requiring bespoke arrangements to be built. In some cases, we've had housing having to be purposely built in special occasions, given the complex nature of there. So there is some really good work that is ongoing. We're all around this. But many of these delays take years in the planning and then months in the transitions. So we are working well with our health and social care partnerships and feel that there are some new and innovative ways that we're starting to come forward. So that should hopefully be helpful for there. But I do appreciate your concerns, and I think that was the hope, that if you look at the figures, what we're planning and building for is probably about 50% larger than what we need it to do. But at the same time, we need to ensure that we have good community facilities, estates, and that we're moving people to the right environment. Otherwise, what happens is that, and we have experience of happening, is that they end up in a treadmill of being out just to get them out, and then they come back in because we don't have the right community support. So totally understand your concerns, and just to give you assurance that we're all aware of that and actually working hard on moving that forward, and apologise for what can appear to be a lack of progress on that area. Jenny, I don't know if you want to come in, or Dave.
I can add some specific detail in Dundee. So at the moment we've got one reportable delay, which doesn't mean we've not got more people in hospital. Quite a number are in the process of transitioning, which, as Sandra said, can take quite a long time, particularly if you need authorisation for people to move where there's forensic needs. But just for people's own kind of build up and to make sure it works, that process of being on passes. In addition to the one reportable delay, we've got 4 that are coded as 100, which is because there isn't any resource in the country that would meet the needs. And it is, as Sandra says, a matter of commissioning things that are really bespoke. We've pulled together a kind of grouping of acute and the other partners in Tayside to look at doing that collaboratively and regionally. And we're actively exploring a number of options around that to see if we can develop something.
Well, that's interesting then, that there's 4 that are, I don't know what code 100 means, obviously means there's no such
resource exists. You need to create something that doesn't exist.
So they could be delayed discharges forever and a day then, because
they could be, but I would want to provide assurance that they won't be.
Sure. Yeah, sure. Raymond.
Yeah, thanks, Ken. I mean, I'm just going to repeat what I've said in the other IJBs when this paper's been presented. The concerns that staff side have. We fully appreciate the fact that the environment isn't suitable and that there needs to be a change in that. But we do have some significant concerns around the ability to be able to staff this model, given the information that we have around the fact that the majority of the staff are based in Dundee. Also, the impact that it has on this client group when we do move them, particularly in significant distances. But in particular to the paper, Ken, though, is that I'm concerned with the amount of risks that are sitting here that are high, and how that's delivered and how understood for the board around 10, I think it's just, I just lost the page, but 10, I think it's 10 high risks and 15 medium risks. That's quite significant for a project I would have thought this size. Thanks, Chair.
Thank you. I'm sure you'll... Yeah, Sandra, sorry.
Yeah, happy to come back on that. So a couple of points, Raymond. Good to hear that, and it is helpful to know that Partnership are supportive of the reason and the rationale for the move, and that, and also acknowledge that the risk around the workforce, and just to let colleagues be aware, there is a planning in place for looking at that mitigation of that risk, and that has been through our internal governance's process as well, through CET and through our staff governance and reserve business. So that's been explored, and we have shared that risk and what we're doing to mitigate that, and we have gained assurance that people are content. The other area that you're raising, Raymond, is you're right, that, and I think it reflects back possibly to what I think it was yourself, Dorothy, or Chair, I'm not sure, apologies, can't quite recall, but saying that we've been waiting for this to move since 2018. And I think the level of risk associated with this, some of these risks are around about reputational, they're about organisational, they're about workforce, they're about finance. And this has not been an easy decision. I think if this was an easy move without any risk, this probably would have been completed quite in 2018. But all of those risks show that we're going into this with our eyes wide open, that we're well versed in the risks, we're paying due course and due attention to those, and not losing sight of the impact that this has for our staff, for our patients, for our families, for our infrastructure, for our reputational, for our finance. All of those things are considered there. They are high risks, they need to be there, and you need to be assured that we're taking them as read, that that's what they are. There are mitigations in place for all the risks, but this is going to be an ongoing situation that we need to be, you need to be assured that we see the level of risk that's associated with this, and that we're managing that accordingly. hopefully that helps, Raymond.
Thank you, Sandra. I'm heartened by what you said about the next quarterly report will hopefully contain some more information, and that's indeed in our recommendations, that we note the progress and instruct the Chief Officer to provide a further update by no later than 31st August. So that would be our August meeting. If you're able to come. Yeah, I'm just going to bring you in, Bob. Yeah, I'm not going to move on.
Sorry.
I'm just going to finish what I was saying to Sandra, which I've now forgotten. Yeah, if you were able to come along, if you've got a space in your diary, that'd be very helpful. And Bob.
And thanks very much indeed, and thank you, Sandra, and others for the report itself. Because there's going to be quite a lot of design work involved in the future provisioning, etc. What forms of co-production are taking place with folk who are heavily involved as service users and others in this area? Because some people who have gone through this process themselves at some stage in their lives. And I think that would be an important element of bringing reassurance around the reputational risk, is that we're actually incorporating the views of those who are most affected by these things. So there's something about not just this group, but others who've gone through this group of service users that could be helpful in terms of this co-production and moving forward throughout this. I think everyone acknowledges there's a very complex and very difficult program you're undertaking here. But I think the more we bring in folk who are directly involved in these things, and that's what disability co-production is about, and also in some kind of advisory role, I think is often helpful as well, that we would do for a project as complex as this one, because because the needs of this particular client group are very complex, but they're not insurmountable either. And I think that's something that I think there's a lot of good work can be done here, even in the circumstances, even knowing that the difficulties have arisen because of the delays. So my sense is to be front-footed on this in terms of the co-production opportunities that you can take up.
Thanks, Chair. Just respond to Bob with that. So yeah. Absolutely valid points, Bob. And what would be clear is that there are three separate, if you like, needs that are required. We have three different areas. We'll have a learning disability assessment unit. We have our forensic services, which is medium secure, and we also have the enhanced care units. The enhanced care units are the ones that are requiring a significant level of clinical input, if you like, for the environment. And the other ones are less so. They're more of a straightforward. The one thing I would ask colleagues not to lose sight of is that ideally we would have no inpatient beds. So ideally, we're not designing people's lifetime accommodation. What we're designing is for people who are coming in with a specific requirement for inpatient care to be then discharged home. I think what Jenny's talked about that really working together on the community aspect, that's exactly where that co-design comes in, Bob, because that is their end, their lifetime home. Within the inpatient setting, it's about meeting the needs that we've got. However, I would reassure you, we have a patient and families work stream that's there. Jenny's actually one of the chairs of that group. And we've had engagement with there. We're arranging visits. We're making sure that, and one of the key things, exciting things actually, that's came out that one of the families proposed was using patient passports. And that should significantly help with the transition and help to make sure that we've got the voice of both the patient, the families, and that any new staffing and any transition is absolutely reflective of what is important to them, what matters to them, and that moving forward. But really good points, Bob, and we were definitely not losing sight of that.
Yes, and I'm glad that you're holding bringing in the families, etc., and guardians, I would have thought as well in some cases. So thank you for that. I really appreciate that. Thank you. That's
been really helpful that you came along this morning, Sandra. And as I said, the recommendations are to note progress and to instruct an update by no later than 31st August 2025. So we'll look forward to that. Thank you.
Thank you, Chair.
Okay, so that takes us on to the next item, which is item 6, statutory review of a caring Dundee 2, and this is for a decision.
Yeah, who would like to speak to this, please?
That's myself, Chair.
Okay, thank you, Andy.
So This is an update on the statutory review of our carer strategy, a Care in Dundee 2, including the outcome of the consultation with carers. The review showed that we've made significant progress in our delivery plan, but most elements remain appropriate. The recommendation is therefore to revise the current strategy rather than replace it, and we're seeking the IJB approval to proceed and also to revise the short break strategy alongside this. Thank you.
Okay. Any questions or comments on that? Dorothy.
Thank you, Angie. It seems there's a requirement under the Carers Scotland Act to carry out a review by the 21st of April 2025.
That's correct, and that's what we carried out after the last paper to the IJB.
So that's been done?
Yep.
Right, okay, that's what I didn't understand, Angie, from the report. Sorry, that's, me not understanding. So we've done the statutory reviews by the specified date.
Yeah, so the section 4.2 describes the process that was followed and the actions that we took. There's a section at 4.3 around the involvements framework that was published in November as part of that work. There's an outline of the national and regional local developments. And then 4.5 is the progress that we've made under the current delivery plan, which we have pulled together as part of that review.
No, that's fine, Angie. It was my lack of understanding. Sorry, it was just my lack of understanding. It has been done by the scheduled date. That's fine. Thank you.
Yeah.
Martin?
Thanks, Chair. Very briefly, just to say that I was quite heavily involved in the consultation element of the report by visiting different care cafes across the city. And one of the issues that, one thing I got out of that exercise was the fact that the issues affecting carers across the city, from the West End through to the Brotty Ferry and from Fintry down to the waterfront, it's exactly the same issues. It's not like we have a regional, a sub-regional issue of one area's got one particular issue that's affecting them, or another area's got something else. They're all the same issue. So developing the strategy, developing the future actions that will come out of that, I feel it's going to be quite a simple exercise, because we won't have to develop really specific issues, just be one big generic issue. The big ones, of course, have been issues surrounding services, access to services, how to navigate the system, and the other one that came out from discussions was, of course, the big one is finance. The fact of it's not just budget, not just benefits, but it's also issues surrounding will and planning for their end, but also in terms of employment, seeking employment, trying to retain employment. So again, these are issues that came out with the discussions I had with carers across the city. And I think this report is a good stepping stone onto developing future plans.
Thank you, Martin. I don't see any other hands. Can we agree the recommendations from 2.1 to 2.5, which includes the recommendation at 2.3 that a revised version of the short break service statement is developed during 2025-26, and that we have a final report no later than 31st October of this year? Is that agreed? Yeah, thank you.
Thanks, Chair. That takes us on to item 7, Adult Support and Protection Improvement Activity Update, and this is for noting.
Good morning. I will talk to that one if that's okay, Chair.
Yeah, thanks, Jenny.
This is an update report in relation to the inspection that concluded in August 2023, in which our adult protection arrangements as a partnership were found to be effective. 6 areas highlighted as being good and 6 areas for improvement, 3 of which predominantly relate to the health and social care partnership, so I'll take those first. Those were to ensure that our procedures were up to date, quite a bit in relation to our key processes, and also the review of our quality improvement framework. And as much as those sound like separate ones, they were in fact really quite intertangled. So we always expected this would be you know, at least a year, 18 months, and getting this all unpicked. And the starting point of that for us was getting the procedures right and then rebuilding some of our IT systems and things to accommodate that and building the assurance framework around that. Excuse me. So good process in that we've updated our adult protection procedures, including large-scale investigation, and they're all available on the Dundee Protects website. Significant amounts of work done in relation to key processes, including rebuilding of a chronology workstream on Mosaic and improvements in our risk assessment process. And that's all obviously underpinned by quite a lot of organisational development work and support to staff to get that in place. And we're signed up for things like QI work nationally around chronologies to take that further forward. We have developed an audit tool that's been tested, and we've had the kind of results of the use of that, which have indicated that we've seen significant improvement in terms of risk assessment and less improvement in relation to chronologies, but nevertheless an improvement in the use of chronologies, and not necessarily outstanding in terms of benchmarking with other areas. It's an area that causes challenges across the piece. I'd probably also highlight that the other aspects that we're working on are in relation to partnership activity around the adult at risk work, and that's a kind of whole system change in relation to the way we manage protecting people, looking to develop a multi-agency screening hub for adults and ultimately a screening hub around families rather than a complete distinction between children and adults, and also a team around the adult approach that can then feed into a team around the family approach. So significant work being done. We've got 3 working groups and an oversight leadership group in relation to that, and we're hoping to start testing something in relation to the screening hub imminently. Happy to answer any questions in relation to the report.
I think adult support and protection is dependent to a large extent on public awareness and reporting concerns about vulnerable citizens. I know that we've had campaigns about that in the past. Has there been anything recently or anything planned? Because I know that we could probably do that quite cheaply via the social media channels.
I'm not aware that anything's planned, but I'll take that as an action for a discussion with the committee.
Thank you. Is there anyone else? No. So that is for noting, as Arlene said. So next item, please.
That takes us on to item 8, Strategic Planning Advisory Group, Terms of Reference, and this is for a decision.
So, Chair, I'll pick up on this one. Catherine would have normally discussed this when she's on leave this week. So, in terms of this, Strategic Planning Advisory Group, as says in the paper, is a legislative requirement for the IJB to have a strategic planning group. Kind of sits underneath the IJB and provides the advice around the strategic plan and the delivery of the strategic plan to the IJB. It's probably not it's not completely apparent to some IJB members that kind of group exists, but I think in terms of, and that's something we want to kind of try and improve over the coming months. However, all the sort of policy reports that kind of come through, all the changes around our strategic planning have kind of gone through the strategic planning advisory group in the first instance before they get to the IJB. Excuse me. So we are required to kind of review our kind of the sort of remit in terms of reference of the group. So that has now been done. The strategic planning group itself is kind of has reviewed the terms of reference and has kind of provided some updates and revisions to those. So what we're seeking today is for the IJB to make sure the IJB is satisfied that the kind of revised terms of reference covers what the IJB thinks is required. And if so, we can then kind of move to implement those formally as terms of reference for the strategic planning group. So again, happy to take any questions on this.
I don't personally have any issues with accepting that. Dorothy?
You'll not be surprised to note that I had a number of questions on this, which Catherine very helpfully answered for me in the main. One of my I'm one of the people that Dave referenced from the IJB who needed some more clarity on the role of the SPAG vis-a-vis the IJB. One of the things that jumped out to me was under the remit of the SPAG, it said that it would monitor progress against the actions and outcomes arising from the strategic plan. And in my view, that was the role of the IJB, and of course it is. But I don't think that was terribly clear in the terms of reference, and Catherine has suggested that they could make clearer that the SPAG provided a supporting role to the IJB, because it's our role to monitor. So I'm grateful for Catherine's work in responding to my copious queries on this, and I think I understand how it works now. Thank you.
Thank you, Dorothy. Bob.
Thanks very much. It's good to revisit these documents anyway. I would agree, Dave. I think that the profile of the strategic group needs to be much more elevated than it currently is, because I think the more as we move ahead, in the challenging world we're now at, the importance of this group will become even more significant. And I would add into that the valued inputs of users and carers needs to be strongly strengthened. And I think as you know, Dave, I've already asked Roger Rennie to look at how we can increase the membership of such individuals on the IJV. We'll get advice on that shortly. But I think my main one is around the remit of the group itself, where it talks a lot about third bullet point on delivery of local strategic shifts and outcomes. Now, as you know, Dave, the Scottish Government guidance now is steering us more towards cross-boundary working and thinking beyond our immediate patch in Dundee. And I think the strategic document needs to reflect that new guidance that's coming from the NHS Scotland around these matters, because the red thinking now is now looking at local and regional and national all at the same time. And I wonder if we need to reflect that in our remit, because we're no longer just looking at local strategic issues.
Dave, I don't see your hands going up.
Yeah, no, thanks for that. So yeah, that's an interesting one, Bob, in terms of that kind of national move around from a health perspective around kind of more regional and kind of regional collaborative work, because I suppose when you kind of take it back to the IJB itself, I mean, the legislation under integration is very much focused on locality, and there's still that kind of focus on localities, which is why the kind of membership of this in particular, the focus of this particular group is on localities. But so I think there's a bit of a kind of disconnect between what's coming out from government just now, and I know that's primarily around the health system itself, and the sort of the integrated world that we inhabit. So I appreciate that as something that we know collaboration across across the kind of region as well is essential, and I think we've been doing that over the last 10 years. But I'm probably kind of reluctant to kind of then change about the focus of the strategic planning group in that way, because because the legislation is around for integration is around localities just now.
No, I hear that. Because of where historically it's been. But I'm thinking about the recent documentation that was circulated through Health and Social Care Scotland, which does affect the IJVs in terms of there's three key themes, and one of them was definitely around cross-boundary working. So I would like to see an update on this issue from the document that was circulated by Arlene the other day there, in terms of what does that mean for us, this new approach for health and social care partnerships. because it was circulated to all of the chairs and vice chairs across Scotland for IJVs. So that is the way of thinking, and I need to know, because it will clearly affect the remit of the group moving ahead, irrespective of what you've just said, which is understandable from the current perspective. But I do think we're now in a fast-moving, changing world around about reform, and whatever the NCS will look like, and we'll likely get potentially more guidance around from the NCS advisory group. So I'm curious to know how we're going to adapt to this. So I think we have to move to adapt to it fairly quickly. So I would like to see some update on that document that was circulated.
Yeah, I'll have to have a look at that. But was that in the last couple of weeks, Bob? Because I was off for 2 weeks, so I'm still catching up on email. I think
that Arlene circulated
okay.
to the. I think it went to the whole board.
Right, thank you. Raymond.
Thanks, Chair. Dave, my question is probably about the membership and exclusion, or the remittance of trade unions or partnership colleagues from health and the membership of this group.
Yes, sorry, just coming on that. So what we've got in terms of the core membership is actually prescribed in the legislation around who should be involved in that particular group there. We do have opportunity to kind of add to that where we feel it's appropriate. So I'm happy to kind of take that back through the strategic planning group around trade union kind of representation around that, because I see it's not kind of one of the ones that we've actually kind of added in as more discretionary. So I'll take that back, and if we think that needs to come back to the IJB, then we'll report back at a future date on that one.
That's helpful, Dave. Is that you happy with that, Raymond? Yeah. Yep.
Yes, thanks.
Yeah, Dorothy, you're up next.
Good question from Raymond, and thank you, Dave, for that response, which it reminded me that one of the other concerns I had about this report related to the membership of the group, specifically that there are gaps, there are no service users, and I cannot stress how important it is to have service user engagement in these important groups. And I would really like, Catherine has reassured me that actions are being taken to try and improve that situation, and I would like if we could have some kind of an update. I don't think we have any service user representation on this body either currently, which is concerning. So I just wanted to highlight the importance of this, and I hope that we can improve that situation going forward.
Take that on board as well. Just to be clear, though, I mean, it does say users of healthcare services, users of social care. That's service users, isn't it? Or am I not understanding that correctly?
Yeah, but they don't actually sit on the group.
Sorry,
we don't have
core
any
membership, though, or do we not have?
In terms of the strategic planning group, yeah. So kind of service users, either kind of healthcare or social care users, are a kind of key part of the group. It's just at the moment we don't have any nomination on any nominated individuals at the moment.
Okay, I understand. They should be there, but we just not got anyone yet.
It's more about the individuals are not actually kind of have been identified. Sorry.
Does it say that in the report? I must have missed that. Anyway, yeah, well, at least they're supposed to be there, and hopefully we'll get the appropriate people to represent these interest groups. I don't see any other hands, so are we happy to approve the revised terms of reference? Yeah, thank you.
That takes us on to item 9, which is the IJB Strategic Risk Register Annual Report, and this is for noting.
So that's me. So just looking at the changes in the risks over the past year. The 4 highest risks are restrictions on public sector funding, unable to maintain the IJB spend, staff resource and lack of capital investment in community facilities. They're at the maximum score of 25. 3 new strategic risks have been created or escalated, changes to IT systems, national insurance increase and information governance. Only 1 risk decreased, and that was around the National Care Service, which, although we recognised that it's decreased because of the original plan to abolish IJBs, that's been withdrawn, but there's still uncertainty. And 4 risks had been archived in the past year. So that was staff resource, Dundee Drug and Alcohol Recovery Service, mental health services, and the impact of COVID-19. And the future risk management work is we plan to have the further session to implement the risk appetite and associated targets. That's what we did over the past year, and another risk management development session.
Yeah, we certainly have a lot of risk, although I think we're all fully aware of that following our recent budget meeting, which was a difficult one, because a lot of the risks are around financial resources, aren't they? Does anyone have any comments on this rather scary diagram with a lot of red in it and a lot of amber? Raymond?
Yeah, and I think you've said it there, it's the scary red bits. But it's just a question, because obviously the exposure at 25 is the highest exposure I think we have. You know what I mean? But then we have the control factors that are stated. I mean, so when I look at 25 and then I have control factors that sit, then that means I've no confidence in the control factors because it's at 25. So I'm just trying to understand why, because I think anything that sits at 25 means we have no control. You know what I mean? It's very quite restrictive. So it's just to trying to understand that, whether it's Claire or Dave around that risk, because I think, like you're saying, it's quite scary, Ken, to see all the red. And so should we be quite, I think we are scared about the risk level that we're sitting with, but then if the control factors are there, should that not be slightly reduced? And it's just a question, thanks.
Lynn, would you want to comment, or Dave?
Thank you, Jim. I think Dave might well be responding directly to the question from Raymond. Mine was a separate one, so.
Yeah, okay, Dave.
Love that. Yeah. Thanks for that, Glenn.
I didn't think you were the right person to go to, Glenn, but I thought maybe I got it wrong. But yeah, Dave.
Yeah, so I think so again, good point, Raymond, in terms of the kind of the level of risk and the kind of control factors. And I think what we're kind of showing just now is the current level of risk that we've got, because some of the kind of the control factors are either not kind of working effectively as we can, but some of that's out with our control. So if you look at things like the finance ones, we can only control so much around our sort of financing. We can't really control how much money we receive from directly from government and from the kind of council and NHS side, for instance. And there are other aspects around things like kind of staff resource, etc., which are, if you take it from beyond the IJB's perspective, are things that are, back to the partner bodies around their kind of workforce plans, recruitment, etc., and even kind of wider than that in terms of having some elements of kind of recruitment around sort of kind of the professional bodies and kind of and the learning or sort of universities and other institutions as well. So some of the things are things we can control, and we kind of put factors in that we can, and others are kind of with that control. I think one of the key things and key elements that we do need to kind of finish off in terms of our development is around risk as an IJB, is our risk appetite, because we've kind of done some development on that, but we've actually not kind of taken that final step around setting our risk appetite as an IJB. And I think once you put the kind of context of where our risk appetite is against those strategic risks and the scores, then is back to which ones are, although they might be red, are we kind of accepting that's still within our appetite to kind of to sit within a red kind of high level given a range of circumstances, and other ones where the risk appetite and the actual kind of risk assessment are out of kilter, and what we need to do to kind of bring that back within the risk appetite. So I think it's a fair point. I think there's still a wee bit of kind of development work to go in terms of our risk management kind of reporting and processes.
Would you want to come in as well, Glenn?
Thank you, Chair. It's a similar question in that you mentioned the recent budget proposals and agreements at the last IJB meeting, and I'm wondering whether or not we need to be more explicit, perhaps, in relation to the deliverability of those proposals, any risks associated with the deliverability.
Dave?
Yeah, so part of, so if we look at things like, so in terms of the financial savings, for instance, that will be kind of reflecting those back within our financial monitoring reports during the year in terms of the risk assessment around delivery of all those savings. So there's the aspect around the financial risk, but we need to can also further develop around our understanding of what other risks might be, sorry, non-financial risks, the impact of them, for instance. So obviously, we had concerns around kind of risk of harm within the community of kind of scaling back on some of our activity and what that would mean. So we need to kind of find a way of linking the financial risk and those non-financial risks within our future reporting.
Claire.
And yeah, so the next quarterly risk report is due at the next pack, and we do plan to do a big update on all the risks, especially after the budget. So it's not just the finance ones that will be changing, it is impacting on lots of other risks as well. So yeah, there will be kind of significant updates on the other risks as well following the budget.
Okay. So yeah, that's for noting. Anyway, Dorothy, did you want to come back in?
Just to say, Dave, are you proposing then some kind of a session on risk appetite for us in the near future?
I know we have a lot of sessions programmed, and don't we? I'm not.
There is one in June. So that
June.
will be the one where we've taken the work that we did on risk appetite. We'll have set targets and kind of look at the rescoring as well as a category. So I think that's in June, the next risk and assurance, I think it was called.
Yeah, it's the 11th of June is the development section of water insurance risk. Yeah.
So yeah, that's for note. I would normally have a break at this point, but I'm prepared to be guided by what other people want, because we only have 2 items left on the agenda. Are members happy just to continue, or would you like a 5-minute break?
Happy to continue.
Continue.
Yeah.
Okay, see
Happy to
everyone.
continue, Chair.
Okay, thanks.
Okay, so that then takes us on to item 10, Audit Scotland Annual Audit Plan 2023-24, and this is for a decision.
Thanks, Chair. I'll just pick up a quick introduction to this one, and then we've got colleagues from Audit Scotland who will take us through the paper. Yeah, so this is our annual audit plan with our Audit Scotland, our external audit partners. So the covering paper just covers the sort of key highlights and the points of the plan, with the full plan being detailed in the appendix. You know, I'm pleased to note that the overall the risk assessment from the risk assessment principles, materiality levels, etc. from Audit Scotland remain fundamentally unchanged from previous 23-24 to 24-25. Although, and it is timely that this is on here, you know, they have identified an additional risk that they want to concentrate on in this year in terms of that financial sustainability. So absolutely agree with that, and absolutely recognise that needs to be part of a major part of the of their process, and welcome that part of it. So it's anticipated that we'll be presenting the unaudited accounts to the IJB in June, and at that point, once they're signed off by the IJB, then we will hand them over to the Audit Scotland team. And then the team will work through their audit process for the annual accounts, and be returning back at the pack in November to get these signed off, is the plan. Rachel Brown and Mary O'Connor are with us today, so I think Rachel might want to take us through a few key points of the plan and the work that her team will be undertaking over the coming months.
That would be helpful. Rachel, were you happy to do that?
Yep. Yeah, thanks, Chair. I'll just run through this paper quite briefly. This annual audit plan, so I should say I'm the appointed auditor for the IJB, and I and the team confirm in the plan that we are independent as the external audit team. We are fully independent of the IJB, and that's a requirement to confirm that to you as those charged with governance, IJB members. So this covers the planned audit work for the 24-25 audit year. We tag our audit years in accordance with the financial statements year that we're auditing, although the scope of our audit is wider than just the financial statements audit. The scope of our audit set out at paragraph 5, or summarised at paragraph 5, that sets out that in addition to the audit of the financial statements and me providing an audit opinion on those annual accounts, that we also look at wider scope areas as a public sector audit model in Scotland that covers wider scope areas of financial management, financial sustainability, vision, leadership and governance, and your use of resources to improve outcomes. And we also look at the IJB's arrangements to deliver best value. So I'll draw your attention to the audit scope and responsibilities section, which sets out the respective responsibilities of me as your appointed auditor and your responsibilities and those of the Performance and Audit Committee in terms of the audit process. I'll draw your attention to paragraph 9. We make a fraud risk assessment of all audited bodies as part of planning and risk assessment, and that's reflected in our significant risks of misstatement or wider scope risks. So paragraph 9 is just to draw to your attention if there are any matters related to actual or suspected fraud, or the assurances you get as IJB or indeed Performance and Audit Committee members around counter fraud arrangements for the IJB. If there's anything you want to bring to my attention, please do so. I'll ask you again at the end of the audit. We obviously discuss fraud risk assessment with officers and with internal audit as well, which has informed this plan. But if members have anything they feel that I need to know that has not already been brought to my attention, then you have the opportunity to do that. So I'll take that with any questions at the end if anybody wants to raise anything. The audit of the annual accounts section sets out the materiality levels that we are working to. As Christine said, those are broadly similar, same percentages as last year. Those are the trigger points for if we discover a misstatement, whether it would impact on my audit opinion. So if something's material, I would expect that to be adjusted in the audited accounts, and if it wasn't adjusted, it would mean a modification of my audit opinion. The performance materiality is a trigger for whether we do further work. If we find an error on a misstatement above that level, we would consider doing additional audit procedures. But I note that's at the higher end of our range, so that's a reflection of the good quality financial statements that have been submitted in previous years. And the lack of misstatements or audit findings in previous years. So that's an indication of why performance materiality is so high. The other element in this section that I draw to your attention is the significant risk of material misstatement, which we are required to report to you in the audit plan and then report how we have addressed it at the end of the audit. So it's a standard presumed significant risk. The auditing standards say we cannot rebut that. So that's a standard risk in any audit. It's not specific to Dundee City IJB, but there is presumed risk that management are in a position, should they choose to manipulate financial reporting by overcoming internal controls. And we set out our planned audit assurances, our planned audit response. And for the IJB, that's largely getting assurances from the audit of the statutory partners. I am also the appointed auditor of Dundee City Council and NHS Tayside, so all that information sits within my audit portfolio. So I am fully confident that I will have the required audit assurances by the end of your audit. We also confirm just below Exhibit 2 that any key audit matters, so anything that was not as significant as that risk of material misstatement, but anything that was above the reporting threshold or that I felt I needed to bring to your attention would be flagged as a key audit matter and reported as a significant audit finding in the annual audit report. You may recall that section being in last year's annual audit report as well. We set out some information on the wider scope and best value work. And as Christine said, we've identified financial sustainability as a wider scope risk that we will review the progress on your financial recovery plans, your financial reporting to the IJB, and how informed members are on that, and just the progress that's being made on achieving financial balance, on service redesign and transformation, working with other bodies, with partners to deliver financial sustainability. So we will report on that in the annual audit report. It's not, I'm looking at it specifically on this audit, but I will say I am also raising that risk on other IJB and other audited bodies audits. You're not alone in that, in tackling those challenges, and I fully recognise the challenge that you have ahead of you. We also set out the timetable and the audit fee. Unfortunately, we are still in a process of recovery of audit timescales post-COVID, and I'm looking at the full 5-year audit appointment for bringing back those deadlines. So we're sticking to the November deadline for this year, as we did last year. And excuse me, I'm going to cough. I beg your pardon. And the final point was that the audit fee is the baseline, £34,000 audit fee. So that's a 1.9% increase on last year's fee. And we've not charged any additional fees. There's no aspects that would affect additional audit work I'm planning to undertake on the audit. And the very final section is a summary of Audit Scotland's quality arrangements, and a note that we engage with internal audit and we avoid duplication of internal audit's work. But we're not planning to place any formal reliance on internal audit work to reduce our testing. We're just take cognizance of all their findings in our audit work, and obviously pay attention to the opinion of the internal auditor as a key piece of assurance for your own annual governance statement in the annual accounts. And the final section of the plan says that I'd welcome feedback from members, either directly to myself or to Audit Scotland at any time. We do issue an audited body survey to the chair of the Performance and Audit Committee and to the Chief Officer, Chief Finance Officer at the conclusion of the audit. But I'd welcome any feedback on the audit from yourselves. And I'll pause there and take any questions on the plan or the audit process. Thanks for your time.
The message just came up, it was muted. Yeah, thanks for talking us through that. Rachel, does anyone have any questions? Dorothy?
I don't have a question, Rachel. I just want to say it's a good, clear report. You know, it says what it does, what it says it's going to do, and I'm grateful for how it's laid out in the plain English language that it's used.
Okay, so we're asked to note the content of this report and approve the proposed audit plan for 2024-25. Is that agreed? Yes, thank you.
That takes us then on to item 11, financial monitoring position as at February 2025. This is for noting.
Okay, thank you. I'll take us through this one. So this is our 11 months of actual plus 1 month of projected for the financial year 24-25. As at the end of February, we are sitting with a slightly improved position with a projected overspend of 7.892 million. And that's an improvement of 870,000 from the previously reported figures that we shared with you based on the end of December position. As I alluded to at the March budget setting meeting, I already had an indication that this is where we were sitting, and that was why I was a little bit more confident of having additional funding set aside in terms of our budget planning for 25-26. So having an overspend of just under 7.9 million, we know we've got £4 million set aside in our reserves as part of our financial plan for 24-25, and a further just under 4.8 in general reserves. That means basically the overspend that we now have sits within our funding that we have in terms of the IJB reserves, and there's no financial risk passed back to partner bodies in terms of financial risk support to the IJB under the integration scheme. And on this basis, I'm anticipating that we'll have just under £900,000 of reserves at the end of this financial year. A couple of things that have actually driven the improvements from the December figures through to the February. One was the sort of finalisation and resolution of the pay uplifts and the backdated pay for 24-25 to all our staff through both health and the council's employees staff. That kind of, all those backdated payments went through sort of November, December, January timescales. And the actual cost has been less than we were actually anticipating and had built into the projected position. So that's a bit of an unwinding of a provision that we'd built into previous projections. We have seen some improvements in our primary care prescribing in sort of from about October, November onwards. With volumes of prescriptions generally still being in line with the plan, but actually the average pricing of prescriptions been a little bit lower this year than we would actually built into plan. And as well as that, we've seen the robust recovery actions that we've been implementing through this year finally starting to sort of come through in terms of improved expenditure trends. It does take a little bit of time for shifts to actually come through into the ledger. So we're starting to see that improvement coming through. Notably, there's also a small improvement in the older people care at home overspend. While it's recognised this is clearly still a significant cost pressure to our resources, it's good to note that the spend profile through 24-25 had stabilised and then actually starting to show some signs of reduction in the overall spend. But absolutely recognise that we've our strong performance in terms of the hospital delayed discharges and unmet need and social care has been maintained through that. Obviously, we know that we've still got more work to do on that side of things and to manage the spend down to the resources that we've agreed at the budget within the budget setting process for the new financial year. But it's good that we are starting to see some of that improvement, but the performance still being maintained. But one of the areas that we're actually seeing a bit of a financial deterioration from sort of December figures through to the February has actually been in learning disability accommodations with support, where we've seen some additional costs incurred, where we're trying to making sure we're providing sufficient and appropriate support to individuals with particularly complex needs. Now that's probably quite pertinent given the earlier paper that we looked at with the LD transitions and recognising that these the individuals in our communities do have particularly complex needs and that those needs can fluctuate and the resources that we have available to support them may need to fluctuate as well. So unfortunately we've seen a bit of an increase in spend for just a handful of placements, but unfortunately these particularly expensive placements in terms of the support that these individuals need, and therefore can have a material impact to our overall position. But our managers, our teams are continuing to make sure that we've got safe, appropriate and cost-effective care packages and supports to these individuals. So I'm confident that they're doing the best that they can to make sure that both it's safe, appropriate, but also cost-effective for these packages. Across the organisation, we do continue to have a number of vacancies. Excuse me. Some of these are continuing to be held or have been long-term, and we're actually continuing to plan to hold these due to our financial constraints and the prioritisation of particular posts, or effectively the deprioritisation of particular ones. But we are continuing with our robust sort of internal management reviews and decisions about which posts are we do want to put forward for advert, and we want to continue to recruit to, obviously these being patient facing or frontline posts, critical posts. So these are posts that we will continue to be putting forward for recruitment. But we're also recognising that some of the vacancies that we have are actually hard to recruit to post as well, with national sort of shortages of staff in particular skills or experience. So yeah, our managers will be continuing to look at flexible options in terms of skill mix or how they fill the vacancies and meet the needs of our population with the resources that they have, both financial and staffing resources. But as a result of some of the sort of our longer term absence figures, our hard to recruit to posts, and also the recruitment timescales within our partner bodies, we do continue to have a very heavy reliance on supplementary staffing in particular areas as well. So while we've got cost underspends from vacancies in some areas, we've actually got then resulting overspends because we're having to backfill this with the supplementary staffing. That's not the way that we want to be doing it. So, we obviously need to be proactively managing our staffing resources and prioritising our recruitment where we can, and reducing our reliance on supplementary staffing. So that's obviously part of our ongoing plan as well. So details of the breakdown of all of our numbers are in the appendices as normal. There is a table in 4.6.1 which shows the projected year-end reserves for this financial year based on the latest financial projections, but also incorporating the agreements that we set in the budget setting meeting. So that shift of funding from the transformation pot to the general budget support for the new financial year, and also the shift from our general underspend to the budget revenue support. And at this stage, my team are actively working on closing out the 24-25 financial position. We'll bring obviously our unaudited draft accounts to the IJB in June, along with a comparable report to this to share this with you. Without tempting fate, everything is going to plan so far. I've probably absolutely tempted fate now with actually saying that, but there's been nothing that's come forward as yet that's making me sort of financial concerns about where our closing position is for 24-25. I'm hoping that it will be in line with our projections that we've been bringing to you. Hopefully even a bit better as some of the trends are continued. But maybe I shouldn't have said that. Maybe I should just reserve judgment and wait until we've actually got the bottom line figures to. But yeah, I'll be bringing the numbers to you in June. Happy to pick up any questions.
Yeah, that's good to know that it's gone according to plan so far. Bob Benson.
Thanks, Chair. I look at 433 Learning Disability Services. Obviously, there's been a deterioration in that position. Now, with every year, there will be a fresh cohort of people who will be leaving children and youth services into adult services and who will require community care provision. So the question is, what kind of forecasting can you do realistically, given that you know there will be additional pressures in these areas? And we know, and certainly from the last discussion we had earlier on today about the level of staff expertise that you need in this area to support these care packages, how confident do you feel that our forecast of demand in this area will not continue to outstrip what budgets we have? I mean, that overspend position deterioration is over 500,000. So that gives me some anxiety just on that figure alone. This isn't a major surprise, I should say, but I'm not confident at this stage about how we can even plan for this figure safely.
So within the budget plan for 25-26, we have built in I think it's £1 million of additional resources for that sort of transition. So yeah, there is that, and I know that we have our teams have regular communication between children and families and health and social care partnership adult services in terms of future transition planning from for the younger people that will be moving into adults. So there's that ongoing. We've got a constant review of places that we have and appropriateness of accommodation and packages that are available as everything all evolves. And And we've and also then there's obviously the work from with our inpatient colleagues as well in terms of that transition for individuals and that resource transfer as well that will anticipated to follow as well for the individuals who will be moving from inpatient delayed discharges out into the community. What I would just say is a significant part of the increased overspend that we've incurred this year was actually related to a very small number of packages, but needed agency staff, premium agency staff going in sort of an emergency situation. So there is an element of premium and reacting to a particular situation or situations that occurred there. That's not necessarily going to be ongoing recurring cost pressures in terms of the increased demand. There is an underlying increase in demand, but the particular situation with some of this increase was sort of one-off situation as well. But we do need to be mindful of that longer term planning so that we don't get into similar situations with sort of increased cost pressure as reacting to emergency situations.
Yeah, thank you. And I'll be monitoring this one quite closely. Thank you.
Yeah, so I think we all will. They're particularly expensive packages in terms of financial terms because of the complexity and the support that individuals need to support them.
Thanks for that. I don't see any other hands, and this report is for noting. Thanks for that update.
I see Martin's hand up. Chair. I see Martin's hand up.
I don't see it actually. Martin, you're welcome to come in, Martin, even although I don't see your hand.
No, my hand's not up. I'm quite happy.
All right, okay. So yeah, that was for noting then. See, just before we move on to the items that are kind of inconsequential, we're not going to be having to debate anything. I just want to say that Dave's told me that this is Susie Brown's last meeting of the Dundee IJB, as she will be leaving NHS Tayside. So I'd like to thank you for your contributions whilst you've been on the Dundee IJB, and wish you all the best for whatever you're planning to do in the future, Susie. Thank you. And I think Bob's hand's up. It might be at a similar point.
Well, it is actually. This is also our outgoing Director of Public Health, Dr. Emma Fletcher. She's leaving this week, I believe.
Oh, really?
So I think we should recognise the contribution she's made towards the IJB's work.
Yeah. Dorothy?
Thanks for that information, Bob. It reminds me that Emma's report, Public Health, Director of Public Health report for 2025 has been released, and I'm wondering if and when that will come to the IJB.
Yep.
Yeah, no, thanks, Dorothy. It's a good point. So we will likely take that to the June IJB. It'll be our kind of next kind of opportunity to have that. So obviously Emma herself won't be there to present, but we can get somebody from Public Health to kind of do that. Thanks.
Okay, thank you.
So thanks for that, and good luck, Susie. And the last two items, please, Arlene.
Okay, so that takes us on to item 12, which is the attendances at meetings, which is submitted for information. Item 13, which is the IJB development sessions that have been arranged for the rest of the year. And item 14, which is the date of the next meeting, which is the 18th of June.
Thanks very much, everyone, for your attendance. Hope to see. Christine, you want to come back in before we go?
Yeah, it was just very quickly. I know it's not on here, but there's a visit for an opportunity for IJB members organised for next week, a couple of weeks. So if anybody is still looking to join that one, if you can respond back to the email as well that Arlene previously put out.
Thank you. Okay, bye everyone. See you soon. Bye.